Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now how are you going to treat the treatment of hepatic injury? So in the hepatic injury, first now we will see the treatment or management. In the management of a patient with hepatic injury, first you will see that unstable patient. If the patient is unstable, then you should do an immediate laparotomy is done in the unstable patient, number one. That conservative criteria for non-operative management is, so when do you do a conservative criteria? So for unstable patients, definitely laparotomy. Then if you see the stable patients, for stable patients we have two options. One, we can do it a conservative technique, or we can do a surgery. So first, when do you do a conservative technique? Conservative technique can be done if conservative criteria can be done if the patient is hemodynamically stable with no peritoneal signs on examination, and if there are no other injuries. If there is no peritoneal signs, no other injuries, and the patient is hemodynamically stable, then we can do a non-operative management can be done. Then second, there can be failure of treatment. Most of the failure of treatment occurs in first 24 hours of life. So what is first 24 hours of admission. So what does failure of treatment means? Failure of treatment means that if the patient has, in failure of treatment, the patient will develop hemodynamic instability, or he may develop requirement of multiple liver related multiple transfusions despite of angiographic embolization. If the patient develops signs of peritonitis, or if the patient develops compartment syndrome, abdominal compartment syndrome, then it is treatment failure. That is actually failure of non-operative treatment, or we can say that it is actually failure of non-operative treatment. Failure of non-operative management is due to the following, that is development of hemodynamic instability, or liver related multiple transfusions, or signs of peritonitis or abdominal compartment syndrome. In such cases, we should do surgery in the patient. So what are the procedures that you do? If the patient has a deep liver laceration, so in deep liver laceration, we can open the liver wound. First, you open the liver wound and you can directly approach the bleeding vessel and you can dissect it. So this procedure is known as tractotomy. It is also called as tractotomy, where you open the liver wound and directly approach the bleeding vessel, which is called as tractotomy. Then you have, if there is penetrating liver tracts. In penetrating liver tracts, you can do a tracheotomy, or tamponade can be done using a balloon catheter. Using a balloon catheter, tracheotomy or tamponade is done if there is penetrating liver tracts, or if the patient has injuries near the vicinity of retrohepatic inferior vena cava. If the injuries are near the retrohepatic inferior vena cava, then packing is done alone without any post-operative exploration. Then, if there is retrohepatic inferior vena cava injury, if there is retrohepatic inferior vena cava injury, atriocaval shunt or Schrock's shunt can be put. So, for this liver injury patients, in the surgery of liver injury, the most common complication is liver parenchymal necrosis. Complications after surgery. So if you see complications after surgery, these patients will develop liver parenchymal necrosis is the most common complication after the surgery of liver liver injury. Then in the non-operative management, the most common complication in the non-operative management is rebleeding is the most common complication of non-operative management.
thank you and thank you for watching.